Welcome to today's HealthLine webinar from the American Association of Kidney Patients, Building Resilience, Strategies for Managing Mental Health and Kidney Disease, supported by an educational donation from Travere Therapeutics. Thank you for joining us today. My name is Erin Kahle, and I am AAKP's Director of Patient Insights, Data Analytics, and Advocacy. I oversee our patient research and education activities, as well as our grassroots engagement activities, such as our Ambassador initiative, which falls under our Center for Patient Engagement and Advocacy. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. We built this center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research, shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We encourage you to respond to our flash surveys and other engagement opportunities that you receive via email as a member of AAKP. It is my pleasure to introduce our speaker for today's webinar, Jennifer Jones. Jennifer is a two-time kidney transplant recipient, the first in April 2015 from an altruistic living donor, and the second from a deceased donor in November of 2021. In 2011, while serving in the United States Marine as a combat camera videographer, her kidneys declined while forward deployed to Afghanistan. After being medically evacuated back to the States, she was diagnosed with membranoproliferative glomerulonephritis type 1 idiopathic. Jennifer is currently the Vice President of the American Association of Kidney Patients, an AAKP Ambassador, and a member of the Center for Dialysis Innovation Patient Advisory Board, the Patient and Family Advisory Council of Quality Insights Renal Network 5, the National CASER Patient and Family Engagement Learning and Action Network, the Veterans Transplantation Association, and Kindness for Kidneys. She is passionate about advocacy for policies that improve the quality of life for the kidney patient and their families. Jennifer, we're so happy to have you starting off 2023 with a wonderful presentation from you, and I turn everything over to you.
Thank you so much, Erin. Hello, everyone. I greatly appreciate each and every one of you for taking valuable time out of your day to tune into the webinar. When I'm not heavily involved with the efforts of AAKP, I'm a certified resilience practitioner that works with individuals depleted by adversity and who are ready to create a resilient lifestyle. I teach them how to develop a flexible mindset so that they will be able to maintain grounded optimism, be effective in coping, and quickly adapt to challenges. I came across the sciences of resilience and positive psychology while trying to navigate my own kidney journey that was causing me anxiety and depression. The tools that I have learned help me adapt, survive, and thrive with 2 stints on dialysis and 2 kidney transplants. We're going to do something a little different, as this will be an interactive experience so that not only you will gain a new perspective on resilience, but you will be able to return to this webinar and practice the strategies that I'll be teaching you today. To help you get focused and grounded, let's start with a gentle, deep breathing exercise. Research has shown that learning proper breath control can significantly improve well-being, combat feelings of stress, and relieve anxiety. Breathing exercises help put your body in a relaxed state, and when your body is relaxed, your brain becomes more relaxed too. It's especially helpful when you feel like you're about to lose your temper, which I know can happen with all that we have to deal with. But I have a disclaimer. If you have a lung condition like COPD or asthma, or if you experience pain or difficulty breathing, speak with a healthcare provider before trying any type of breathing exercise. All right, you can do this sitting or laying down, whichever is most comfortable. Now, close your eyes, unless you're tuning on the road, of course. I tune in these webinars sometimes on the road. All right, start becoming aware of your breathing. Place one hand on your abdomen at the waistline and the other hand on the center of your chest. Without trying to change anything, simply notice how you are breathing. Notice where you are breathing from, whether your shoulders are rising and falling, whether your chest is rising and falling, or perhaps your belly is rising and falling. Notice how your hands move as you breathe. Now, notice the rate of your breathing. Are you breathing rapidly or slowly? Are you breathing deeply or more shallow? Now, as you slowly inhale, imagine the air flowing deeper into your belly. Feel your belly fill with air as your lower hand rises. Pause at the top of your breath and then follow your breath out as you completely exhale. We're going to do a 4-count breath. All right. Slowly take a breath in, 2, 3, 4, and slowly exhale, 2, 3, 4. Let any tension melt away as you relax more deeply with each breath. Notice how the air feels as cool, fresh air enters your nose, passes through the little hairs in your nasal passage, reaches the back of your throat, and descends deep into your lungs. Notice what happens as that breath of fresh air enters your lungs. Notice what happens when you exhale. Feel the temperature of each breath, cool as you inhale and warm as you exhale. Count your breaths as you breathe in and out. Notice your breath becoming smooth and slow. Feel your belly and ribcage expand outward with each breath, and feel yourself become more relaxed with each exhale. Allow your shoulders to become heavier with each exhale. Continue breathing slowly and gently. Again, slowly take a breath in, 2, 3, 4, and slowly exhale, 2, 3, 4. Feel yourself becoming more and more relaxed with each exhale. All right, now, as I count from 5 to 1, feel yourself become more alert. 5, bringing your attention to where you are. 4, feeling calm and relaxed. 3, start to wiggle your fingers and toes. 2, slowly start to move and stretch your muscles. 1, open your eyes, returning to the present moment. Welcome back. All right, now you're probably wondering, what does deep breathing have to do with building resilience? Well, first, let's go over what resilience truly means because there are a lot of misconceptions about the word that I believe can be harmful, especially to someone with chronic kidney disease. The word resilience comes from the Latin verb resilire, which means to leap back, which is why the most commonly used definition is that someone is capable of bouncing back from challenging circumstances. However, the word resilience was used inappropriately during the pandemic to where others equate resilience with working until they drop with no regard for their safety or well-being, struggling on their own with no support, and the pressure of having to bounce back. And if they don't, then something is wrong with them. Personally, I am not a fan of that definition because if someone is feeling depressed, anxious, or angry about their situation, they may believe that they're incapable of being resilient and could feel a sense of shame about that. Not only are those feelings normal, but extremely common for people with CKD. Hospitalizations due to psychiatric disorders, particularly depression, anxiety, and substance abuse, are 1.5 to 3 times more common among patients with CKD than individuals with other chronic diseases. Depression is the most frequently reported psychiatric condition in CKD patients, especially in those with end-stage kidney disease. There are quite a few misconceptions about resilience, but I will focus on 3 that will help reframe your perspective on the concept. Number 1, resilience is something that you're born with. Resilience is not a fixed personal attribute. Rather, it ebbs and flows in various circumstances and over time. To be resilient, to adapt to adversity, can feel doable in some situations and out of reach in others. That's normal. Feeling that you are unable to cope with your current circumstances does not mean that you are lacking resilience. It actually means that your resilience has become depleted at this particular time. With CKD, we can learn to predict the situations that will deplete resilience. It's worth thinking through what those circumstances are for you. If you can identify depleting situations and plan for how you will manage them, then you are exhibiting resilience. Number two, being resilient means that you can handle everything by yourself. There are times throughout my kidney journey that because I'm a Marine and a Black woman, I feel that there have been assumptions made by others that I'm always this strong, independent person who doesn't need help from anyone. And unfortunately, to my own detriment, I have been critical of myself when I didn't feel strong at all. I felt depressed, vulnerable, fragile, and not in control of my circumstances. I was the one who helped others, not the one who needed help. This sounds familiar, I bet, to a lot of you. I realized that somewhere along the way, I didn't like the idea of being the one who needed help. So it was very difficult to ask for it. I learned that being specific in what I wanted when I asked someone for help was beneficial, and that despite what you see in the media these days, there are people who are kind and want to be of service to others. The truth is, our resilience is compromised when our needs are not being met. People develop resilience in the context of social connectedness, first in attachment of relationships with our families, our caregivers, and then in relationships with the wider world. You can strengthen resilience by reaching out for help, whether it is from loved ones, your nephrologist, or a mental health care professional. And number three, resilient people are always in a good emotional state. Being resilient does not mean that we don't have feelings about what we're going through. Remember that emotions are not either or. It's not happy or sad, suffering or grateful. We can be resilient and upset about our situation at the same time. We can be grateful for what we have, but miss what we lost as well. Sometimes living with CKD can make you feel unseen due to your resilience. There are times when family, friends, colleagues, and even your healthcare team in charge of your care may fail to see the vulnerable feelings that sit alongside the resilience. Some people may feel that trying to tell others what they are going through is seeking pity or attention. I must emphasize that there is absolutely nothing wrong with wanting others to recognize how hard your life can be sometimes with CKD. Living with CKD can keep you in a state of ongoing hypervigilance. This disease is unpredictable and can be uncontrollable. It can create prolonged stress in your relationships, work, and how well you manage your health. Your mental state is as important as everything else required of you as a kidney patient. Conditions such as stress, anxiety, and depression can worsen your symptoms. They may also make it harder to follow your treatment plan or practice the healthy habits you need to live well with CKD. Because of this, I would like to encourage you to begin approaching resilience from a psychological perspective instead. The concept of psychological resilience is recognized both as a personality trait and as a process that changes. From a traits perspective, people differ in their general ability to deal with adversity. Over the course of a lifetime, some people may develop a personality trait to better deal with life challenges. From a process perspective, resilience is conceptualized as a dynamic process that depends on circumstances. This means that a person's resilience may alter if circumstances change, such as a life altering chronic illness. Fortunately, resilience is teachable, not just by going through tough challenges, but for example, a deep breathing exercise may be a helpful way to cope with the current situation. Also, despite resilience being typically associated with the individual's ability to cope with negative life events, resilience can also develop from effective dealing with positive events, like savoring time spent with your children, for example. Last November, I had the privilege of speaking at the American Society of Nephrology's Kidney Week about behavioral challenges that may arise in adherence before and after kidney transplantation. While researching the topic, I found a couple of studies that show the importance of building and maintaining resilience as a kidney patient. A 2020 study by psychologists from a university in Iran selected 30 new kidney transplant recipients to take part in a resilience program that was focused on teaching self-efficacy, which is an individual's belief in their capacity to act in the ways necessary to reach specific goals. The findings showed that resilience training in renal transplant patients enhances self-efficacy, empowerment, and social adjustment, thus promoting their physical, general, and psychological health. It also can facilitate the process of empowerment, accompanied by increasing self-efficacy and social adjustment of patients. Also, a 2005 study by the Institute for Health and Aging at the University of California conducted 5 in-depth interviews over several years with 38 respondents between the ages of 65 and 91. Respondents demonstrated determination, perseverance, and tenacity, no matter how serious their illnesses were. Racism helped to shape the responses of these African Americans to their illnesses through cultural values that emphasize independence, spirituality, and survival. Respondents showed a resilient philosophy as they faced a disabling illness. Now, yes, I'm aware that these are very small, localized studies. However, I strongly believe that there should be more research done to show how resilience can benefit kidney patients at any stage of their diagnosis. Earlier, I mentioned that your resilience may be depleted if you're currently unable to cope with your circumstances. You are capable of identifying which events and circumstances deplete your resilience, but I want to give you a list of common characteristics that have been recognized in people with low resilience. Not everyone exhibits the same characteristics, which range from mild to severe in nature. It can last for varying durations. Being able to identify these characteristics in yourself can help you determine whether you should engage in resilience building activities. These characteristics are also common in some mental health conditions, such as depression. So if you have these characteristics for a long period of time, or if the severity of one or more interferes with normal functioning, please tell your nephrologist and consider seeking assistance from a mental health care professional. Irritability and anger. Being quick to anger and feeling irritable is a very common characteristic of low resilience and often leads to conflict with others. Becoming isolated or over clingy. As our resilience diminishes, people can either start to isolate themselves from other people or become too dependent on having family or friends around them. Personally, I am a chronic isolator because in my mind, I feel like that I'll be a burden to others when I'm not feeling well mentally or physically. Moodiness. As resilience diminishes, there can be a change in our body's hormones that causes mood swings. It is also very hard to control our emotions. We can experience extreme highs and lows, sometimes several times a day. Overreaction to normal stress. For example, you're at the dialysis clinic and it takes longer than usual to get connected to the machine because it's a busy day. That can be slightly annoying. However, a person with low resilience may overreact and become enraged. Easily depressed and crying. Some people with low resilience find they feel sad a lot and cry more easily than they used to. Been there, done that. Risky behavior. When our resilience is low, we tend to lose some social control and may find ourselves not taking our medications when we should, eating those comfort foods that don't adhere to the renal diet, or even skipping dialysis treatments. And lack of hope, which is the most troubling characteristic of low resilience. It's a lack of vision for the future. This can sometimes evolve into despair or worse. By understanding these characteristics, you can look for these behaviors in yourself or ask your caregiver, a trusted friend or family member, to help identify these behaviors and get a sense of your own resilience on any given day. To ensure that we do not completely deplete our resilience altogether, we can practice simple strategies like the deep breathing exercise we did at the beginning of the webinar. I'm going to share with you 4 more strategies that you will be able to do at home, in the hospital, or in the dialysis chair. I know this because that's where I have used them to alleviate stress and anxiety. These have been an integral part of my coping with challenges, building resilience, and maintaining a mental space of grounded optimism. During periods of anxiety or panic, practicing with the 5-4-3-2-1 coping technique for anxiety can help ground you in the present when your mind is bouncing around between various anxious thoughts. Before starting this exercise, pay attention to your breathing. Slow, deep, long breaths, if possible, can help you maintain a sense of calm or help you return to a calmer state. Once you find your breath, go through the following steps to help ground yourself. Acknowledge 5 things you see around you. It could be a book, a spot on the ceiling, anything in your surroundings. Acknowledge 4 things you can touch around you. It could be your hair, a pillow, or the ground under your feet. Acknowledge 3 things you hear. This could be any external sound. If you hear your belly rumbling, that counts. Focus on things you can hear outside of your body. Acknowledge 2 things you can smell. Maybe you're in your office and you can smell coffee, or if you're in a sterile environment and you smell hand sanitizer. And if you're able to go elsewhere to find the scent, you could go to your bathroom and smell your soap, or go outside and smell nature. Acknowledge 1 thing you can taste. What does the inside of your mouth taste like? Gum, coffee, or the sandwich from lunch? For the 3 good things exercise, you will remember and list 3 positive things that has happened in your day and reflect on what caused them. In doing so, you will tune into the sources of goodness in your life. The hope is that you will remember events that otherwise would have been overlooked. It is a habit that can change the emotional tone of your life, increasing an overall sense of gratitude for each day. Every day, write down 3 things that went well for you that day. Also provide an explanation for why they went well. Preferably, create a physical record of your items by writing them down. The items can be relatively small in importance, like I had a nice chat with my friend, or relatively large, like I got the call for a kidney. After each positive event on your list, answer in your own words the question, why did this good thing happen? For example, you made the nice chat with your friend possible because you called them. To make this exercise part of your daily routine, some find journaling before bed to be helpful. As you write, follow these instructions. Give the event a title. For example, my coworker complimented my work on a project. Number 2, write down exactly what happened in as much detail as possible, including what you did or said, and if others were involved, what they did or said. Number 3, include how this event made you feel at the time and how this event made you feel later, including now as you remember it. Number 4, explain what you think caused this event, why it came to pass. You may also focus on what you did to make this good thing happen. Use whatever writing style you please, and do not worry about perfect grammar and spelling. Use as much detail as you would like. The 3C method is based on cognitive behavior therapy and can be used when you realize that you have been focusing a lot on the negative, believing that every negative thought that you are having may be true, despite what the true current circumstances may be. This practice will help you capture the current state of affairs and do so in a way that allows for positive, flexible solutions by maturely accepting what is and orienting towards a positive adaptation of what you are dealing with. Step 1 is to catch it. When you notice a change in your mood or become upset, ask yourself, what am I thinking about right now? Number 2 is to check it. What is the evidence for the thought? What is the evidence against the thought? Is it completely true? If it isn't, then move to step 3, which is to change it. What is a more truthful or a more helpful thought instead? Now, you're probably wondering, well, Jennifer, what if the thought is completely true? Then what do I do? Well, I have had plenty of thoughts that didn't go past step 2 because not being happy about having to do dialysis is true. Experiencing pain on a daily basis is true. And the dread of having to spend a long time in the hospital is most certainly true. When things go wrong in life, we can very easily get caught up in thinking about how disappointed and regretful we feel, criticizing and blaming ourselves or others for the mishap, and focusing entirely on what we have lost and what the situation has cost us. In this exercise, which will help you find the silver linings in challenging situations, we're going to practice looking at the bright side of an otherwise grim situation, which builds resilience and optimism. Step 1, shift into a positive mindset. Make a list of things that make you feel like your life is enjoyable, worthwhile, and or meaningful at the moment. Make a list of at least 3 things. The purpose of this step is to help you bring about a positive state of mind. You can also refer to the 3 good things strategy if you are practicing this as well. Number 2, identify a recent difficulty. Now, think about a time recently when something occurred beyond your control, or when you felt frustrated, upset, or annoyed, or something that's happening right now. Create a brief description of the event. Step 3, identify costs. What did this difficulty cost you? In the space below, write down the negative things that came out of this difficulty. Let it all out. Step 4, find silver linings. Now, since you got all the negative things out, rather than dwelling on the negative consequences of the situation, let's look at the bright side and consider what you gained from it. Come up with at least 3 positive things that came out of this difficulty. I'll start. For example, when I was on peritoneal dialysis, I was having complications to where I experienced pain while draining on the machine every night, and it was causing me to think and feel very negatively. Ultimately, I had to return to hemodialysis, and by then I was kind of over it all. I know many of you can relate to that. After completing this strategy, the silver linings that I came up with um, became sort of a mantra that I would tell myself on dialysis days. It starts like this. Before 1945, the first successful dialysis treatment, end-stage kidney disease was an automatic death sentence, and now that is not the case. I am grateful to have access to a machine that can keep me alive until I'm able to receive a kidney transplant. And I am grateful to those who are working to expand the innovation and technology of dialysis to improve the quality of life for all kidney patients. Now, I am not dismissing how I feel, but trying my best to focus on what's good about my situation. Ultimately, those negative feelings would dissipate and I would feel more optimistic. Not necessarily happy, but it would get me to my dialysis treatments every week. Now, I'll be honest with you. This is probably the hardest of all of the strategies that I've shared. But focusing on negative experiences too much can have a detrimental impact on your health and well-being and can put you in a state of depression. The solution is definitely not to just ignore those thoughts because that will also deplete your resilience. In a study that examined the effect of finding silver linings on a daily basis for 3 weeks, participants were seen to experience greater engagement in life and least dysfunctional thinking by the end of the study. For example, they stopped believing that making a mistake is a sign of weakness. Interestingly, participants who were more pessimistic at the beginning of the study experienced greater benefits, showing fewer depressive symptoms afterward. I wish I could guarantee that all of these strategies will work for you, but I can't. I'm sorry. They certainly will not work if you do not truly give these a try, have an open mind, and remain consistent for at least a couple of weeks. Now, don't try to use all of these at once. Try 1 or 2 at a time, and when you are ready, incorporate more. The goal isn't to make all of your bad feelings go away forever. I wish it was. It is for you to start feeling more in control of yourself and your feelings, to give yourself grace and compassion, especially when you feel like you aren't getting it anywhere else, and to find some peace among the chaos. Now, there are many strategies like this out there that you could work on alone or within your support team. Now, I highly recommend AAKP's Coping, Living, and Thriving with Kidney Disease brochure, which will empower you to take charge of your disease management by confronting negative feelings and providing strategies on how you and your team can thrive and become the warrior you want to be on this journey of kidney disease. You can find a free download of the brochure on our website under Educational Brochures and Resources, or you can order a physical copy for yourself and your team for only $1.50. Please don't hesitate to contact me if you would like to further discuss what I have shared with you all today. Like, this is my thing, so please contact me. We are all in this together. I'll close with this quote by American business executive, billionaire, and philanthropist Sheryl Sandberg. I think there are things that we can all do to build resilience in ourselves, but also to build resilience in each other. Thank you for your attention.
Thank you so much, Jennifer, for a wonderful presentation. This is such an important topic, and it's clear that it's dear to your heart, and you are certainly more than qualified to share these tips and tricks for individuals who may be going through some rough patches. So thank you so much. I wanted to bring to your attention a few questions that people submitted when they registered for the webinar that I'm hoping you can address. Our first question here is, how did you handle fatigue from chronic kidney disease?
Thank you, Erin. I'm still trying to handle fatigue with chronic kidney disease, to be honest. Um, first and foremost, it is very important that you let your healthcare team know if you're experiencing symptoms of fatigue, because there's a possibility that it could be anemia, or if you are on dialysis, you could not be receiving adequate dialysis. You could be being under dialyzed. So it's best that you uh, talk to your nephrologist, see if you can get lab work done. And if you're anemic, there's a possibility that you may be prescribed medication or an iron supplement. That's what I'm on. I'm on an iron supplement. And also if you're being under dialyzed, then hopefully they'll be able to adjust your treatment. So also, if you are for those also who are on dialysis, make sure you watch your fluid intake, because taking too much fluid off during dialysis can definitely wear you out, and you feel drained by the end of it. After dialysis, when you get home, if I'm sorry for those who have to go straight to work, back to work, I can relate, but if you can, try to get some rest until you feel less tired. Like it's sort of like having a recovery time. But if you could not, possibly not, don't try to fall asleep. Try not to fall asleep, because you want to maintain a regular sleep schedule. I think that's what's helped me a lot, is to go to sleep at the same time and to wake up at the same time, so I don't feel as worn out as I usually do. And I know for some they may feel this is counterproductive, but gentle exercise will help you feel less fatigued, like going on a 15-minute, 30-minute walk, or doing some gentle yoga, chair yoga, whatever you can to your ability, just for 15 minutes to half an hour. It really does get rid of a lot of that fatigue. And if you can, plan your week so that activities are spread out rather than trying to do too much in one day. I know that's impossible sometimes, but do the best you can. Try to have periods of rest throughout the day. But as I said before, try not to fall asleep. If you have to, no more than a 30-minute nap, but trying to fall asleep at the same time and wake up at the same time is the best bet for you.
Thank you, Jennifer. Those are great tips, and I feel like that gentle exercise can also help lift your mood a lot, which
Definitely.
I'm sure that fatigue pulls you down and makes you feel pretty awful. So I appreciate
Definitely.
you sharing what has worked for you and what can hopefully work for others. Our next question here is, if you have kidney disease, does a transplant affect your mental status?
That's a really good question. It depends. Um, of course, the medications definitely can affect your mental state, your mood, taking prednisone and everything. So that's why please have this discussion with your nephrologist and your pharmacist about these medications and the side effects, so you can gain an understanding of why you're feeling the way you're feeling. And then personally for me, with transplantation, I feel that it's affected me mentally, because I've developed a sense of survivor's remorse, which is something that's very common for service members. You deploy to Iraq and you come back, and then you have a number of individuals who don't come back with you, and you feel like, oh my gosh, how did I come back and they didn't? And I feel that I've experienced the same feelings as someone who's received a kidney transplant. It's devastating to me to see people, when I started on dialysis, and then I get off of dialysis and I receive a transplant, and they're still on dialysis, and it breaks my heart, and it causes me to question, do I deserve it? Why did I receive a transplant when this other person didn't? And it's something that I have to admit still affects me off and on. But, you know, I would tell you is not to be so hard on yourself and to, that's why I love strategies like I've shared with you today to help you get out of that negative headspace and, you know, realize that this is a gift and your mental health is very important. So do what you need to do to ensure that you have a strong mindset while navigating this new life with a transplant and taking care of this precious gift of life.
Thank you, Jennifer. And our last question here for today is, how do you deal with the feelings of regret, guilt, and blame about chronic kidney disease? And you probably touched on this a little bit already with your response to the last question, but I would like to get your thoughts on this.
Yes. Sometimes I like to equate our grieving with the 5 stages of grieving. Like if you lost someone, there's this grieving process, but unfortunately, it's not that linear because of how unpredictable the disease can be. One minute you think you're doing okay, and then the next minute you're in the hospital and you don't even know what happened. So dealing with grief is a process. And one thing I will definitely emphasize is do not allow someone to tell you how long it'll take for you to stop feeling guilt, to stop feeling sadness about the life that you once had, or feeling sad about the life that you wanted without kidney disease. I think a lot of individuals don't understand that this is for the rest of your life. And this is something that you have to accept. I feel that I want to shoot this from the hip. I didn't want to write it down because it's something feeling those feelings are normal and they're natural and it's gonna come and go. And don't beat yourself up about it. And that's why I love these tools and being able to reframe how you're feeling so you won't get stuck in those feelings of shame and guilt and remorse. Don't take blame into yourself about why you're where you are or why you're in the situation you're in. That's neither here nor there. You are navigating chronic kidney disease now, and what's most important is your health and well-being, mentally, physically, emotionally, and spiritually. So that's what you need to focus on, and let those moments of grief and guilt come and go, and cling on to those that are closest to you, and seek out people who are like-minded that can assist you and guide you, and especially those who have been through what you're going through, so you won't feel like that you're going through it alone.
Thank you, Jennifer. I greatly appreciate your heartfelt responses to this, and I know you've had a lot of challenges in the past, and you've come out of them, and you've become even more determined to reach out to others who may be going through similar situations. So we appreciate everything that you do, and for being on this webinar and providing such a great presentation for us today.
Thank you. I appreciate it.
And I'd like to invite you just to say a few parting words for our audience, if you have any.
Oh, goodness. All right. Thank you so very much for tuning into this webinar. I really hope it helps. Like Erin said, the past couple years, which I can imagine for a lot of you, has been extremely overwhelming. And for me, I think one of the biggest ways that I have built my resilience is finding purpose and meaning in my illness. Erin said I had my diagnosis is a mouthful, MPGN for short. And unfortunately, to this day, I don't know what caused it. So I have dealt with that question of why me? Why did this happen? What did I do to deserve this? And unfortunately, when you keep going down that route, it really doesn't get you anywhere. In fact, it actually puts you in a worse position mentally and emotionally. So the best way what helped me get through that is finding purpose in the illness, in the disease. And that's why I became affiliated with AAKP and started doing this kidney advocacy work. because I know that despite the illness and despite the challenges I faced, being a Marine Corps veteran, I'm very privileged in the type of care and treatment that I receive. And it is my hope that one day that everyone receive that access and level to care that I have throughout my kidney journey. And that's what keeps me going in times where I feel like that I'm going regressing and starting to feel down and depressed again. But it's okay to feel sad at times. It's okay to, hey, I need to take a step back. I need to take a break from it all and just regroup and refocus. And just like I said, rebuild and replenish your resilience and then get back out there. There are plenty of people that care about you and they're out there to support you. And you will always find a family here with AAKP who will support you. So like I said, please don't hesitate to contact me or anyone within AAKP, and we will do our best to assist you. Thank you.
Thank you. Thank you so much, Jennifer. I'd like to close today's webinar with a few slides that we have on additional resources that may be of interest to you. And for anyone who has additional questions about today's webinar, you can send those questions to info@aakp.org. If you are not already a member of AAKP, we encourage you to join. We offer free membership to patients and family members, as well as living kidney donors. You can become a free member online at aakp.org or by phone at 1-800-749-2257. Be sure to include your email address when signing up so that you can receive all of the benefits of membership. As a member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our print magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all of the latest news and announcements. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. By visiting our website and clicking on the store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download, including our Coping, Living, and Thriving with Kidney Disease brochure, which Jennifer recommended. You can also order materials by phone. We are excited to announce the dates of our 2023 events. The 5th Annual Global Summit on Kidney Disease Innovations, in partnership with George Washington University's School of Medicine and Health Sciences, will take place in May. Specific date will be announced shortly. AAKP's 6th Annual Policy Summit will be a virtual event held on June 28th. The 48th Annual National Patient Meeting will take place virtually September 20th to the 22nd, and the 5th Annual AAKP Fun Walk will take place virtually December 4th through the 8th, with an in-person walk in Tampa, Florida on December 9th. We invite you to let us know which events you are interested in participating in this year, and we will notify you when registration is open. You can also visit our YouTube channel to watch presentations on demand from our 2022 events and programs. Again, I'd like to thank Jennifer Jones for her presentation today on building resilience and Travere Therapeutics for sponsoring today's webinar. Thank you all for joining us today. Be informed and stay safe.